public settings. And with that, we came educational efforts that came about and demanded more testing, tracing, and treatment, or T3 efforts, for our South Bay communities. And those asks were made of the County of San Diego and the State of California. The City of National City has been at the forefront of battling the COVID-19 pandemic, and as of June 29th, the county reported 638 positive COVID-19 cases, making our community less than 5% of the positive cases countywide. However, even though we are less than 5% of the total cases, the rate of infection per 100,000 population is over 1,000% and continues to concern our healthcare partners. We know that some of the reasons that these data points are high are due to many of our residents being essential workers, including caregivers, grocery workers, and healthcare personnel. Also attributing to that is that we have close housing and familial units with multi-generations living in one household. Unfortunately, inequities in the healthcare system shine a bright light on our community's underlying comorbidities, which include two that are most commonly linked to COVID-19, that being diabetes and heart disease. These facts, in addition to lack of access to ongoing healthcare coverage or insurance, we are eager to partner with the State of California to provide this free walk-in with appointment testing facility here at our Kimball Senior Center. As a result, we see that COVID-19 is affecting over 50% of those between the ages of 20 and 49. I will repeat, COVID-19 is affecting over 50% of those between the ages of 20 and 49. This is why I support the county's effort to press pause and reevaluate how our reopening is affecting this infection rate, the ICU bed rate, and death rate here in San Diego County. We continue to see the growing demand for T3, testing, tracing, treatment. And I'm proud to announce that this will provide our 5th community testing site in the 91950 zip code area. Organically, this is creating National City's T3 community, healthy community hub. Our T3 healthy community hub includes this site plus 4 additional testing sites within National City. They include right across the way at San Isidro Health on 12th and D and 8th and D, Samahan Clinic on Highland Avenue, the County of San Diego at St. Anthony's Church on Sundays, Paradise Valley Hospital for their patients on 4th Street, and this one at sponsored by the State of California. This means that weekly in National City, we will have close to 1,300 free COVID-19 tests provided for those seeking to be tested. 1,300 tests, free COVID-19 tests provided for those who want to be tested. In order to continue those educational efforts, I will also be distributing 5,000 masks within our community through the Masks for Mayors program donated by Bella Canvas and community homemade donations. Those masks will be provided through the free food distribution in partnership with Catholic Charities, through educational efforts of our police and code enforcement, and for our small businesses through our city staff. And lastly, through our monthly free diaper distribution with Miracle Babies. As part of the regional approach to addressing these inequities, I am proud to co-chair the San Diego Regional COVID-19 Task Force for Equitable Recovery Membership Democratic Participation Subcommittee, hosted by our County Board of Supervisors, Nathan Fletcher. And know that our National City T3 Healthy Community Hub is both created organically, purposefully, and is strengthened by all of these efforts and partners. With that, I'd like to introduce Mr. Nick Macchione, Director of the County of San Diego's Health and Human Services. Oh, she's gonna clean. She's gonna clean it. She's gonna clean
it. Good morning. I don't speak as well through my mask as the mayor does. She's phenomenal. And Mayor Salas is one of the leaders in our county. Mayors. She talked about the masks for mayors. By the way, she has a beautiful mask if you haven't seen it. But what you heard her talk about, the number of testing in this city, did not happen by chance. By sheer determination, with great innovation and partnership, led by the mayor and the city council and the city manager and our county team and our community, our great community partners, making sure that we're able to get testing for all the great residents of National City, in fact, South Bay. You know, I'm proud here representing the County of San Diego team, the Health and Human Service Agency, our whole COVID response team for helping in opening up this particular testing site, yet the 5th of the testing sites. And this effort of the county requires, as we always say, a whole village, right? So the county village, Chairman Greg Cox and Supervisor Nathan Fletcher of the subcommittee and the rest of the Board of Supervisors, our Public Health Officer, Dr. Wilma Wooten, who works hard every day keeping the entire county safe. Barbara Jimenez, our leader for South and Central Region. Jennifer Bransford-Coons, who's leading for testing countywide with the T3. Tim McLean on the T3 team, and many others that are part of the county team. We're all joining together, racing to save lives. And Mayor Salas has really been, as I mentioned, that true leader in partnering and ongoing expanding and testing in South Bay. And not just to mention this location, but also earlier testing at St. Anthony's Church. Work with the San Ysidro, the Great San Ysidro Health Center, and supporting Paradise Valley's securing 2 rapid testing machines that they're doing for their patients. Mayor, in your opening remarks, you did a great job explaining this testing site, and hopefully we get could take a little peek view. And if you haven't gotten your test, we give you an opportunity to get your test here. But I'm going to skip talking about the importance of the 144 daily tests that this site's going to provide free to the public. Instead, I'm going to focus on what we both know, and that this site belongs here. You see, our data and our eyes have informed us that South Bay is the heart of our region's outbreak. Expanding testing has become a huge key to our partnership in helping protect our residents and everyone in the region to get through this pandemic. Let me give you a quick update on what's going on in that, what we call the South Bay saturation strategy of having testing all throughout South Bay. Just this week, we opened up at the Tubman Chavez Community Center our first no appointment testing location. No appointments needed. It opened up yesterday, and it's from 8:30 to 5 p.m. I need to advise you, it's a little bit of a longer wait. Not as bad as DMV, but still, there's going to be a longer wait, but no appointments. And why this is important is all of our other sites, we had appointments. And we want to make sure we honor that. But some people have a felt need, or for whatever reason, need to get tested right away. So we have this site, and we're going to be expanding these type of opportunities of no appointments. But right now, it's right here at the Southeastern San Diego where we're offering that. We have testing sites that are also open in Chula Vista, the old Sears building, and the Aquatica theme park in East Chula Vista, and in San Ysidro. And in a few weeks, we'll be opening a new site in Imperial Beach. And I have to tell you, others are going to follow, because we're not letting the virus come to us. We're hunting the virus, making sure we're getting to folks right away, early on, as they're showing any type of symptoms or been exposed to someone that may have been confirmed as positive. And the best way, by the way, to find, we have 23 different locations in the county for testing, 23. Making sure we have it throughout not just the great South Bay, but North County, East County, the city of San Diego. It's very important there we're getting to all San Diegans. And we made it easy, because all you have to dial is 211, or we prefer, you go to 211sandiego.org. And if you go to their website, you can actually do your own appointment. I've done it. It's about 5 minutes or less that you can get an appointment. based on where you want to be tested or when, what date. Now I am going to say, because of what's happening in the state, in the nation of rising cases, we have seen a great rise in number of appointments. We are booked for the entire week, and we're racing to still expand more sites. But it's important that people know that there's an opportunity to get tested in their community. We've made it as easy as possible, and very importantly, as the mayor said, free, no co-payments, no dinero, no money needed, no money, because we did not want to make that an issue for anybody, any San Diegan, in getting a test. Now, T3, as the mayor said, and I have to say, if I could give an award to a mayor, it'd be Mayor Solis. She's a T3 champion as mayors, because she's gotten it. It's about testing, it's about tracing, and it's about treating. We're different in San Diego. We're different in San Diego than the rest of the state. Why? Because we think of helping people live well. Testing is the beginning. And then if someone is positive, is getting to them and helping them understand how do they take care of themselves, maybe their families, their tío, their tías, their kids in the household, or people they've come in contact with. So that's the tracing part. But we have to do this culturally responsive. We have to do this with an equity lens. As the mayor pointed out, we have inequities. We know that. How do we then do the tracing in a way that embraces the diversity and inclusiveness? And so we added something new in San Diego. We did our community health outworkers, but we went to the roots in South Bay in the 70s, something called promotoras. We said, we're going to bring the promotora model, which the community clinic's really one of the leaders, San Isidro. And Barbara's going to talk more about it, but I'm really excited about it because it's San Diegans in the community helping connect people that may be exposed and letting them know what they can do for themselves and their kids to stay safe. That's tracing. But what do you do when you then identify someone and you trace them and you tell them they have to self-isolate? I don't like quarantine. It makes you like you got a disease or you have a problem. But the reality is we talk about quarantining because that means you have to be safe so you're not spreading to everyone else, and you're an ability to stay home safely. You don't need to be hospitalized because if, God forbid, we have great hospitals and clinics and primary care. So you always have to be talking to your doctor to know. But what does it mean when you're then self-isolating at home? How do you do that? And so we did something different in San Diego. We added the third T, treat. That it wasn't just about self-isolating. We have public health nurses connecting with people saying, are you okay? What do you need help? If you don't have a place to self-isolate, the county has over 1,000 public health rooms. We like to call them public health rooms. They're motel and hotel rooms. Where no cost to the individual, we give them a room, we give them the place to safely recover, food and supports. And there's some that can do that in their home, and our nurses are interacting with them to making sure they're safe, to making sure we're helping San Diegans live well. And that gets really the end of this, what we're doing. It's ensuring that as we get through this pandemic, we're trying to race to save lives, protect lives, and helping San Diegans, protecting the health and well-being of San Diegans, so we never miss the point that we, as San Diegans, are helping each other to get through this together. So it is with great pride that the county team is here with the great National City team and our community partners and all of you in promoting this testing site with the state and Optum and the great work they're going to do in protecting our many San Diegans. So thank you very much, Mayor, for including me. And now I have the honor to, after we get disinfected, myself and the whole podium here, of having Barbara Jimenez, our Director for South and Central, to talk about the great work she's doing in the region and a little bit also about promotoras. Please.
Thank you, Nancy. Good morning, everyone. Muy buenos días. As we just heard from both Mayor Sotelo Solis and Nick Macchione speak about earlier, the data demonstrates that our continued expansion in South Region continues to be critical. And as someone who gets to live, work, and play each and every day in the South Region, I'm excited to be here today to support the increased focus on our activities and strategies, specifically in the South Region, and to be part of this healthy community hub in National City. Centro Saludable, it's about the community. The key continues to be coordination and delivery of high-level services as we respond to the threat of COVID-19 in the community. It's about our unwavering commitment to work with our community partners to address the equity among our vulnerable populations. We committed to do more. We stood here before you and committed to do more, and we continue to work closely with our partners to do just that. We not only continue to ramp up our testing as we previously shared, but we also expanded our staffing and our tracing, as you heard from Nick. For the staffing, we focused on diversity. And as we previously shared, we wanted to make sure that we were looking at leveraging our promotora model. And we've done that. In fact, our first group of promotoras, or community health workers, begin work today, with more coming on board over the next several weeks. So my ask today of you is, we need all of you. We need each and every one of you, our residents, our partners, our government, our faith-based, our medical community. We need everyone to work together to really care and continue to show that collaborative and caring features that we have in our community. This community is a diverse community, it's a strong community, it's an amazing community, and we can make a difference in impacting these numbers. But we really need to follow those health prevention messages that we've been talking about. Make sure we're maintaining social distance. Please wear your face coverings when you're out and unable to maintain that social distance. Wash your hands. We have Nancy showing the sanitizing, and just make sure that you do not have those gatherings outside of your household. Let's take care of ourselves, our families, our community, and I'll just close by saying we are honored and excited to really partner with such a passionate leader like Mayor Sotelo Solis, who's been steadfast in advocating for these test sites in National City, as well as the entire South Bay leadership that's been really focused on continuing our expanded testing. More importantly, to be part of this coordinated strategy to really reach our vulnerable populations. So thank you so much. And with that, I'll turn it over to our mayor.
Now we'll do the presentation en español para la gente viendo en español. Oh. Here, let me do one more. Ok, como toqué todo. Ok. Bueno, buenos días. Mi nombre es Alejandra Sotelo Solís y soy la alcaldesa aquí de la ciudad de National City. Gracias por acompañarnos hoy por el anuncio del sitio gratuito de pruebas COVID-19 del estado de California aquí en nuestro centro para personas mayores aquí de Kimball. Esta mañana me acompañan nuestros socios comunitarios, Nick Macchione, director de Servicios de Salud y Humanos del Condado de San Diego, Bárbara Jiménez, directora del Área Sur, Servicios de Salud y Humanos del Condado de San Diego, Daniel Hernández de San Isidro Health, Nayrab Jadeja del Hospital Paradise Valley y miembro del Consejo, doctor Gonzalo Quintero. En abril, el Consejo Nacional de la Ciudad apoyó por unanimously, y fue la primera ciudad del condado de San Diego en exigir que nosotros usáramos máscaras o cubrebocas en lugares públicos. Y con esos esfuerzos educativos surgió la demanda de más esfuerzos de prueba, rastreo y tratamiento, en inglés T3, para nuestro, no nomás la ciudad de National City, pero el condado de San Diego y más bien la Bahía del Sur y nuestras comunidades. La ciudad de National City ha estado a la vanguardia de la lucha contra la pandemia de COVID-19 y a partir del 29 de junio, el condado reportó 638 casos positivos de COVID-19 y lo que hace nuestra comunidad aunque sea 5% del total de casos positivos en el condado de San Diego, nos da mucha precaución porque la tasa de infección por 100,000 personas es 1000% y continuará pues preocupando a nuestros socios. Sabemos que algunas de las razones por las que estos puntos de datos nos dan mucha pena es porque nuestros residentes somos los trabajadores esenciales, cuidadores, trabajadores de los supermercados y son los personales de las atenciones médicas y viviendas, y tenemos viviendas cercanas y unidades familiares con generaciones múltiples que viven en un solo hogar. Desafortunadamente, las acciones en el sistema de atención de salud brillan intensamente las comorbilidades subyacentes de nuestra comunidad. Estos incluyen diabetes y enfermedades cardíacas. Estos hechos, además de la falta de acceso de la cobertura o seguro de atención médica, estamos ansiosos por asociarnos con el estado de California para tener estas pruebas gratis con cita. Otra vez son gratis, pero con cita, y uno se estaciona y entra al edificio aquí en el centro de Kimball Center. Como región vemos que coronavirus está afectando a más de 50% de las personas entre las edades de 20 a 49. Ha afectado más de 50% a la gente de edades entre 20 a 49. Eso es porque el apoyo y el esfuerzo del condado del condado para presionar o para decir pausa, vamos a parar y reevaluar cómo nuestra reapertura está afectando la infección, las camas de ICU y la tasa de mortalidad. Continuamos viendo el crecimiento en la demanda de esfuerzos de T3, pruebas, rastreo, tratamiento, y orgullosamente anunciamos hoy que esto vamos a tener 5 sitios, pruebas comunitarias gratis en el código postal 91950, creando orgánicamente en la ciudad de National City el Centro Comunidad Saludable. Nuestro Centro Comunidad Saludable incluye este sitio y 4 sitios más aquí en National City. Esto incluye San Isidro Health, aquí dando a la cuadra enseguida, la Clínica Samahan, el Condado de San Diego, en la Iglesia de San Antonio, Paradise Valley Hospital para los pacientes que están allí, y este hogar en 1221 D Avenue. Esto significa que semanalmente en National City tendremos cerca de 1,300 pruebas de COVID-19, de coronavirus, gratuitas, proporcionadas a aquellos que buscan hacerse la prueba. Háganse la prueba, es gratis. Estamos tratando de traerlo para que se lo haga más fácil posible. Para realizar esfuerzos educativos, yo y mi oficina distribuiremos más de 5,000 máscaras dentro de nuestra comunidad a través del programa Máscaras de Alcaldes, donado por Bella Canvas, y donación caseras de la comunidad. Se proporcionará a través de la distribución gratuita de alimentos en asociación con caridades católicas, a través de los esfuerzos educativos de nuestra policía y de cumplimiento de códigos para pequeñas empresas y para el personal de nuestra ciudad, y nuestra distribución mensual gratuita de pañales con la organización Miracle Babies. Por último, como parte de un enfoque regional para abordar estas inequidades. Me da orgullo de ser parte del subcomité del Condado de San Diego. Nuestro T3 o el Centro Comunidad Saludable es creado orgánicamente y fortalecido por todos los esfuerzos y socios. Muchísimas gracias y voy a presentarles a la señora Bárbara Jiménez para decir unas palabras de parte del condado en español.
Thank you, Nancy. Bueno, nosotros en el Condado de San Diego, en la Agencia de Salud y Servicios Hermanos, pues reconocemos que el COVID-19 ha tenido un impacto enorme en la población, en nuestros latinos, ¿verdad? Especialmente aquí en la región sur. Reconocemos que aunque nosotros los latinos hispanos venimos siendo 34% de nuestra población local, desafortunadamente más del 60%, 65% de las personas latinos se dieron positivos. Todavía más triste es que reconocemos que 43% de las muertes vienen siendo hispanos y latinos. Entonces, muy importante este trabajo que se está haciendo aquí, particularmente en la región sur, pero en todo el condado de San Diego, es muy importante. Y yo lo que les pido hoy es el apoyo a nuestra comunidad, que por favor hay que seguir todos los mensajes de prevención de salud pública. Hay que lavarnos las manos, hay que desinfectar. No hay que tener reuniones, fiestas, carnes asadas, nada de eso. Hay que quedarnos en nuestras casitas, solamente con nuestras familias. Sabemos que es duro, sabemos que queremos celebrar y reconocer, pero es muy importante que hay que destruir la palabra, hay que cuidarnos, hay que cuidar a nuestras familias, hay que cuidar a nuestra comunidad. Y parte de eso también es viniendo a hacerse la prueba. Haz su cita, o ven aquí, haz la prueba. No tengan pendiente del resultado, no tengan pendiente que si alguien le habla del condado de San Diego y les notifica que salieron positivo y necesitan información, por favor, da la información correcta, es todo confidencial. No le van a pedir número de seguro social, no le van a pedir el estatus migratorio. Es muy importante que demos la información correcta y que trabajamos juntos. Y por último, comentamos hoy que empezó el primer grupo de promotores en la comunidad. Ellos nos van a ayudar también. Enfocarnos en lo que viene siendo los hispanos, los latinos, los que hablan español, la comunidad afroamericana. Entonces es muy importante que seguimos apoyando, trabajando y ayudándonos. Entonces, para nosotros el Condado de San Diego, de parte de Macchione y toda mi junta de supervisores y nuestro equipo que está aquí, muchas gracias. Estamos aquí a la orden, estamos aquí para servirlos. Gracias.
Y con eso, we will now, I'll hit the SAP button. We will now answer any questions that may arise from our media partners over here. Okay, la. I know. See, and this is a good reminder again.